in the middle of my back and then lower back. I've noticed since I started working at the church and I'm just like sitting at the desk all day. I've been having really bad headaches and I'm just tired all the time and I can't sleep. Since I was like 15, maybe. Yeah, especially my lower back and then like right in the middle, like this part hurts. I used to really bad, like right here. No, I landed like straight down, like on my ankles on like rocky ground. And then I just, that was like, I was 15 or 16. Car accident 2 years ago. I forgot about that too. Did a lot better, Brittany.
Yeah, you're gonna be doing good.
Wow.
Feel that right there, Britt?
Yeah.
That's that nerve root. Whenever the atlas goes out, that nerve root's gonna swell up like that. I can help you.
That's crazy.
It's like a check engine light for what I do. The atlas displaces and that nerve gets irritated.
But I don't fit. What does that mean?
Then your atlas is out of proper position.
Oh.
Sorry. She elbows me whenever I do it. So.
Did it hurt when
Yeah. And I just, oh, that was so weird.
Let me get some pictures of you. So on Brittany's x-ray, this is her sagittal film. You can notice that she does have somewhat of a curve through here, but there's a lot of forward head posture, and what I mean by that is her C2 should actually be on top of her T1 back here. So there's a lot of forward head posture, and actually through the lower cervical spine there has been some straightening. There is a touch of decreased disc height, but with that forward head posture and the tension that's going to be on the muscles, it would not surprise me that she would have headaches or neck pain as a result. Relative to the plane of her skull, her atlas is actually rotated nearly 2.5 degrees. The atlas vertebra functions like a pivot.
Okay.
So mechanically, the head is a bowling ball and it should sit on top of your neck.
Okay.
And the atlas is a pivot point. The base of the skull is shaped like a sphere. The top of your spine is shaped like a sphere. And then the atlas is like a cup on both sides. So whenever you have a whiplash, what will happen is those spheres will lock up in that cup. They'll slide in that cup and your new baseline will be off slightly, and then what your body does is it contorts your body ever so slightly to keep your eyes level. This view is her horizontal view. This is her skull here. You can see the back of her skull, the base of the skull, and then the jaw line here. What we notice is a window where we can see the top of the spine. This is the vertebra going up here, C2, and then the atlas, the ring of the atlas here. So for Brittany, relative to the plane of her skull, her atlas is actually rotated almost 2.5 degrees. The problem with that is you have very critical blood flow that's passing through that area where you don't want rotation, along with the very sensitive tissues of the sleeve around your actual spinal cord, which when you have rotation in there, a lot of people can perceive what they would call a migraine headache. And nothing actually protrudes.
Touches me? Oh.
It'll be just off your skin actually.
What does it do then?
So the head is going to be constant on the headpiece and locked in place.
Okay.
What I'm going to be doing is influencing and basically realigning your body back to your head.
Okay.
Okay? The head and neck are in this relationship. I'm going to influence everybody back into
With that.
with the table. The table does actually most of the work.
Okay.
And then once everybody's lined up and set to be in proper position, the sound wave is going to line up based on the directions I have from my math
Oh my god.
at the joint in the perfect position to get it to let go where it should go.
Okay.
So like let's say it's off like this, I'm going to come from that perfect position to set it back.
Okay.
But it's only that everything is lined up to where it should be and ready
Okay.
that I'm going to be able to drop it in place. And that's why you'll hold this longer than having to be adjusted every time. Yep. Pretty cool, huh?
I don't feel that anymore.
I know.
That's crazy.
You got a good set.
My first night I slept without waking up, which was good because I hardly ever do that. And then the next day was really good. And I've noticed my back's been looser and I haven't had as much pain like sitting in my desk it used to be.
How have you been feeling lately?
I'm good.
Yeah.
I don't have any complaints. I get all the time.
Have headaches, right? No?
I used to. I don't as much. Some sleeping problems still, but it's like once every 2 weeks I'll have a night where I don't sleep well versus like once every 3 days. And I don't wake up like as sore anymore. Whereas before, like no matter how I slept with like multiple pillows or like just one or none, like I always woke up like with my neck and like back in pain, and I don't anymore.
You know what's funny though is that we were just talking about dedicating a whole one to you.
Yeah, actually.
Were you talking about a whole video to me?
Yeah.
I might even share it on my Facebook.
There you go.
So